Welcome to my podcast. Today I'm going to talk about another common case that can be seen in the clinical setting or in the GP surgery. So after you introduce yourself, double check the patient name, date of birth, as always we agreed. You'll ask the patient, how can I help you today? And the patient will say, doctor, I'm having issue with my ears. I'm having sort of pain, itchiness, it feels like muffle, and I don't know what should I do. And I tried OTC, but it doesn't seem to help. So you will ask how long ago all of this started. Do you have any thought what might be the reason? Is it something new thing or is it a recurring? Have you been away somewhere? Any medication that you use in the long run? If there is any medical alignment that you suffer with, and any family history of similar thing. And the patient will tell you, no, I don't have any issue. Just started all of a sudden when I went abroad and I was swimming and this kind of things. So in that situation, you have to narrow down your differential and think about what might be the reason for a painful, itchy ear. We know that those sort of things, and especially in the ENT, it makes a significant proportion to the GP workload presentation, which needs always a frequent GP attention. So what basic ear representation with a complex serious condition that mandates specialist intervention in that situation we need to narrow down, and we need to ask the right questions in order to see what can be done and how can be sorted. So as I mentioned, the patient says that I'm having pain, itchiness, and muffling. So in that condition, you could think of infection, debris build-up inside the ear, which could, of course, lead to a sort of deafness. So the patient said that I was abroad swimming and stuff like that. So we know that any beach holiday with prolonged water exposure or a pool will predispose, of course, to infection. And in that situation, the airwalks protection will be lost, and this will enable commensal organism to participate and grow, causing pain and infection. Another definition you need to think of, if the patient, for instance, happen to have psoriasis or eczema, this can lead, of course, to inflammation around the ear, and of course the scale and the debris will partially block the external determinatus, which will lead to the feeling of deafness. Also, the patient says that I was surfing, because some people, they do this as a hobby, or swimming, or the patient is washing daily, frequent hair wash. It's another reason to cause otitis externa. And of course, as I said, if there is any history of medical alignment that you should know of, like diabetes, it's one of the conditions that can participate to this sort of thing. And of course, if the patient like to use the cotton bud sometimes, causing trauma and injury to the ear externally, this could lead, of course, to pain. However, the pain threshold would be varied. It could be mild, could be very painful, whereby you can't even touch the ear banna. In that condition, you need to treat it basically with painkiller, if it was moderate to severe, and of course antibiotic if there is the element of the infection. And in such a situation, they do oral toileting, which is basically microsection, which can be considered a moderate situation. Also, topical aminoglycoside is the treatment of choice in the UK, and you need to bear in mind that the drum is not perforated because that's a contraindication, which could lead to ototoxicity. And in children, you will substitute with Quinol ear drops as alternative choice in that situation. So basically, in the GB setting, the most frequent ENT presentation, and I mean by here the ear thing, is otitis externa, and in children, of course, otitis media, which have different presentations, especially with systematic like fever, malaise, could be vomiting as well. So that's another issue. So I just wanted to concentrate in this podcast about the discharging ear infection or ear conditions, and I meant by that painful, itchy ear, which align with otitis externa. And of course, you need to red flag the patient if the infection does not go away, does not settle, patient not feeling themselves, they need to come back to the GP setting and or go to the A&E if it was late presentation. I hope by that I have just point out some of the points in the otitis externa presentation and how we can approach it and deal with it effectively and efficiently. Thank you.